Ruto government warned, biting more than it can swallow. Is the government over-promising and under-delivering? That's the big question tonight, as President William Ruto's administration faces heavy criticism for its ambitious yet struggling reforms in education and healthcare. Lawmakers and experts are now sounding the alarm, warning that the government might be biting more than it can chew. Let's break it down. For many Kenyan parents, the cost of education is becoming unbearable. The government's new university funding model has left students in limbo. Unlike before, where students would automatically receive funding upon placement, now they must apply separately for loans and scholarships through the Higher Education Loans Board, HELB, and the Universities Fund, UF. Sounds like a plan, right? Well, not quite. Many students, especially those from low-income families, are finding themselves misclassified or completely locked out. The process is confusing, slow, and has left thousands unsure about their future. And that's not all. Our primary, junior, and secondary schools are facing a funding gap of 27 billion Kenyan shillings. Yes, you heard that right. To cover this shortfall, the government is considering increasing school fees. Now, imagine struggling parents already battling high living costs. This could mean education becomes a luxury for many Kenyan children. Is this the way forward? Many are questioning the government's ability to balance its grand reforms with reality. From classrooms to hospital beds, another crisis is unfolding. The transition from the National Health Insurance Fund, NHIF, to the Social Health Authority, SHA, was meant to be a game changer. Instead, it's turning into a headache for both hospitals and patients. Private hospitals are now boycotting SHA services, citing unpaid claims from the government. Patients who thought they were covered are showing up at hospitals only to be told, no SHA, no treatment. Imagine being sick, needing urgent medical attention, but being turned away simply because the system is failing. Even President Ruto himself has admitted the crisis, revealing that his government inherited a 33 billion shilling debt from the defunct NHIF. His latest directive, hospitals owed 10 million Kenyan shillings or less should be paid immediately. But will this be enough to calm the storm? Education and healthcare are pillars of any thriving society. Yet, as things stand, both are at risk of collapsing under the weight of rushed policies and poor planning. MP Makali Mulu says the government is overloading itself, trying to fix too many things at once, and in the process, failing to deliver. His warning is clear. You are biting more than you can swallow. So, Kenyans, what do you think? Is this government too ambitious, or do we just need patience as these reforms take shape? Here's my take. Ambition is good, but without proper execution, it can turn into disaster. We all want a better Kenya, better schools, better hospitals, a better life, but promises alone won't fix our problems. Real change requires planning, transparency, and above all, listening to the people. Over to you, Kenya. What do you think? Are we headed in the right direction, or are we speeding towards failure? This is Sauti Mzalendo, giving you the real voice of the people. Stay informed, stay engaged.